The topic of general anesthesia, or more commonly known as putting your child to sleep for dental procedures, is a quite scary topic, and rightfully so. There are real risks and serious risks that are involved. So when I'm considering that for a child, what I can do is assure you that we have gone through all other options. Either they aren't a viable option for your child due to the extent of decay, how many teeth are involved, and the size of the cavities. We're also taking into consideration the age, behavior, ability to cooperate of the child. And also, it's always safety. Safety is the number one. So if we can't accomplish a good or reasonable result in a safe manner, then we would consider sedation. And of course, the amount of treatment for the age and ability of the child, it could be quite traumatic. Trying to put a 3 or 4-year-old through 4 or 5 long, difficult appointments in the office, it's quite traumatic, and that can be scarring. So oftentimes in that scenario, that's the typical scenario that I'm looking for in recommending sedation is 3 or 4-year-old child who has very significant, extensive decay, just doesn't have the ability to cooperate, may have some even fear, and we don't want to put that kid through multiple long traumatic appointments. At that point, really the best is, hey, let's look at doing sedation for your child. And statistically, it's very safe. When I do sedation for children in our office, I do use Dr. Seiden. He is a board-certified pediatric anesthesiologist. And why does that matter? Is because his level of training and experience and expertise is excellent. There's really no one better qualified to do in-office anesthesia for children in dentistry. He has the ability, he has the training, he has the expertise to both act as the pediatrician, so the medical doctor, and also the anesthesiologist, the one who's both administering and monitoring everything needed for sedation safely for the child. So he's really the best combination of both, and it just makes things a lot easier. He also brings an assistant, and I also have my assistant as well. So we have quite a few people. We have 4 people in the room just for your one child. And so a lot of dedicated and trained personnel to carry out things safely and effectively. Before we go to the day of sedation, we have done a thorough diagnosis and treatment planning, a whole separate visit of a consultation going over all the questions needed about the treatment plan for your child, about how anesthesia works, any questions for the anesthesiologist, and we go over all things concerning finances and scheduling. So all that has been dialed in, so there's no questions walking into the appointment. And on that day of, we check your child in, Dr. Seiden comes out and does his exam day of to make sure, once again, everything is good, your child is healthy and safe to proceed with anesthesia on that day. So that's the check-in procedure. And then we have a nice reception area where parents can hang out. There's a beverage station. You can bring snacks if you want. More than welcome to. Required to be in the building the whole time, of course. It's your little loved one, and we want you present. And so once it's time to bring your child back, the beauty of how Dr. Seiden does his sedation and the induction, which means putting your child under that first part, is he allows you to walk back with your kid to the treatment room on the iPad, watching or playing something on the iPad. And then you get to help lay them down in the chair, and he uses a little mask to help them fall asleep. So there's typically no injection, nothing scary or traumatic, and you get to give them a little kiss goodbye, and then we start our procedure. So after that, of course, we get the child asleep and get everything nice and safe and stable. and then allows me to do my thing as the dentist, to have dedicated time and attention to do things the best possible for the child. When I'm all done, I come on out and report back to you, the parent, telling you how things went, if there's any changes, what to expect afterwards. And we have a dedicated recovery room that the child is then transferred to. Then the parents are invited back to be with them. And there's plenty of time to allow the child a proper, safe recovery. And then once Dr. Seiden has done his final check to make sure the child has recovered properly and is cleared to go home, parents are able to go home. And then I will do a follow-up phone call that evening to see how things are going. When I'm in the operating room environment for a sedation case, doing general anesthesia, the beauty of that environment for me as the restorative dentist, the one who's fixing all the teeth in the cavities, is it frees me up to do my very best, undistracted by anything. Obviously, the child is asleep, so we're not worried about them with their comfort. They're as comfortable as possible, and I can just be laser focused, do my best, and be as efficient as possible because we're typically doing a lot of work in a short period of time. So having Dr. Seiden and his assistant administer and monitor all the anesthesia for the child really frees me up, and I don't have to worry about it at all. So I can just do what I do best and what I do every day, the restorative component of that, and not have to worry about the comfort or the safety of the child because they're in very capable hands with Dr. Seiden. After the procedure of a general anesthesia case, the follow-up is simple and it's quite nice. So we're all done with the procedure, and I've come out to talk to the parents about how things went, if there's any changes, what to expect for the rest of that day. And then they're able to come back in the recovery area with their child and let them wake up as calmly as possible. And they're there right away for their child to see and be able to give them comfort and love. And then Dr. Seiden will come around and he'll check on the child, make sure everything is looking good, and all the appropriate signs are visualized before allowing the child to go home safely with their parents. At that point, I'll just let them know that I'll give them a call later on that day, and I typically do by the evening. I'll just follow up with a phone call, see how the child is doing, have they eaten anything, what's their behavior been, and be able to answer any follow-up questions that the parents may have since I saw them last in the office. Coming to the decision of sedating your child for dentistry is definitely one that we do not take lightly at Explore Kids Dental. In fact, because of my ability to use minimally invasive dentistry and many other methods, it's actually rare that we do sedation. We offer it, we do it, but I actually only do it once every other month now, and typically about 3 cases. So we're not a high volume sedation office for those reasons. So when we come to that decision, you can rest assured that me as the dentist, as a practitioner, has gone through that entire evaluation and thought process, seeing, is there anything else we can do that is reasonable here? Are there any minimally invasive techniques that I can use to manage these cavities reasonably to avoid doing sedation? Sedation is truly a last resort option for me as a practitioner. I do not rush into it, and I don't prefer to do it if I have other methods. And I have many other methods, so that's what I'm happy about too.